Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. I hope you're all doing well. Have a lot of different things to cover today. Really interesting studies over many years, but another new study on how heart attacks may be linked to bacterial infections. This information has been going on for decades and originally was proven in veterinary medicine, where when animals had issues with blood vessel damage, and they started to look at the lining of the blood vessels, which you can kind of see here for my little diagram, where plaque builds up in the blood vessels, cutting away and down to that lining of the blood vessel called the intima, they found various infections. And in human studies over time, same sort of thing. This article, which we'll start with, talks about in 2022, 19.8 million globally died from heart disease. I think that probably is a very small end of the scale number. 85% of these deaths are attributed to stroke and heart attack. Previous research linked bacterial infection as a risk factor, and arterial plaque and buildup has been correlated with bacterial infection, among other things. Fat, cholesterol, heavy metals binding to the LDL cholesterol to become a foam cell into plaque, which I've been talking about for a long time. Some of the bacteria are those that are commonly in the mouth and throat, because when they've looked at these organisms, they found a variety of different strep viridans. And so we've been talking about this for a very long time. So as all these inflammatory agents pile on top of each other, that's what creates the plaque process. For some people that take cholesterol meds, they still have heart attacks. And some people who are forcing down their cholesterol with the statins may be wiping out CoQ10, because that's where the statins work on that pathway of cholesterol production. And in doing so may make the heart weaker, because that CoQ10 is important for heart contraction, mitochondria, all of that. So there are many things going on that set the stage for that heart attack or vascular episode or clot or stroke to happen at some point. But we have to look at all of these parts of the picture, otherwise the process will continue. That's why I think this is an important study to talk about. Pick this up off Medical News Today. And that's why we test for all the different underlying causes, not just cholesterol. We look at the breakdown components of cholesterol, the LDL, 3 different types of LDL, HDL, chylomicrons, homocysteine, fibrinogen, C-reactive protein, infection. Commonly, Epstein-Barr and cytomegalovirus are on board, and that can contribute to it. Heavy metals as well. So we have to be forward-thinking and understand that we can't just look at a person and say, well, your cholesterol's high, here, take a medication and, see what happens. And there are people that have high cholesterol worldwide that don't have any plaque. So we have to look at this a little bit more specifically and take steps to change the problems that are there, the underlying causes. You'll always hear me talk about underlying causes and changing the mechanism rather than allowing these things to exist. I wanted to thank all our followers from TikTok and YouTube, all our different platforms, Google, Apple. Also, Saturdays, of course, our Rumble family, live from America, for people watching and listening and sending in their questions. I have a lot of questions that we get all the time, and we try to answer those questions as quickly as possible. Sometimes it takes a little bit of time to do that, but we work on it. So I thank you for all that.
We've got a question quick from our solo Rumble. We're still on Rumble, just we're missing our beautiful LFA TV audience. But
Yes.
Someone wants to know, what exactly is plaque? Is it fat, cholesterol, or just something clogging the arteries in general?
Plaque is many things, as I try to mention. So plaque is not only cholesterol or triglyceride or sugar, which a lot of people just think is cholesterol, but there are many things that could lead up to that. As I mentioned, heavy metals, lead, mercury, nickel, cadmium, aluminum, various things can bind to the bad LDL cholesterol and become a foam cell, and now that foam cell can add as plaque. If a virus gets to the blood vessel wall and creates inflammation, that can start fat and sugars and other components to add on top of that inflammation to build up and to create your little yellow blotches you see here in this blood vessel. So it's many things. I think there are 50 things that cause plaque. Low vitamins and minerals, because low vitamins allow homocysteine to rise. That causes plaque. Heavy metals, as I mentioned, yeah, the cholesterol, triglyceride, LDL, low HDL, high small LDL, and again, they're the breakdown components. C-reactive protein, which actually is a marker of inflammation, probably caused by infection, different infectious agents. So the list goes on and on. Hormone decline makes it easier for plaque to build up because you're not burning down the cholesterol, triglyceride, and sugars. So depending upon what we see on a big blood test, we'll correct vitamins, minerals, hormones. We can use chelation therapy, calcium EDTA, to bind to metals and pull them out of the system. For some people, doing exercise enhances the blood vessel dilation, so your body is asking the vessels to open up to get more blood flow and then more oxygen, vitamins, minerals, and hormones to your cells. So there's a lot to do to help to improve or correct the picture. But it's a multifactorial disorder. There are even studies that I looked at a few times talking about how stem cell therapy helps to shut down the inflammatory cascade of plaque progression. So another important possible option to help with the plaque progress.
When someone is having a heart attack from plaque, how fast do doctors have to act? Is it a different
Sooner
situation?
the better. Yeah. So the thing that doctors don't like to think about, and of course we're all up against, when a person sees the doctor and the doctor says, "Oh, look, your EKG is showing your ST changes and abnormalities. You're having a heart attack." And when they look at your blood, they see CPK enzymes go up. They see a variety of other markers go up, troponins, and they know that the muscle is being damaged because it's not getting enough oxygen, vitamins, minerals, and hormones. You might also see that C-reactive protein is elevated. Galectin is also another marker of heart muscle damage. So there are a variety of different things to look at that gives them that answer. What we don't like is thinking about, well, what could have been done a while back, a week, a month, a year, to prevent what just happened today with that patient with the heart attack. I think about it and say, well, your BNP is high, your vitamins are low, your cholesterol is high, your heavy metals are there. I think about those things and work on them way beforehand. So we like to think we're preventing that. But when traditional medicine looks at someone who's coming in with a heart attack, they see that event. They give meds. They try to open up, dilate. Sometimes surgical procedures are done to remove blockage or stents are placed. So that's working on it after the problem has already presented. I'd love to prevent that from presenting, which is what we try to do with everybody. Sooner or later, people will have heart issues. It's just statistically correct. So when we talk to patients about low-carb diet, burning down sugar, burning down fat, bringing down weight, bringing down cholesterol, triglycerides, we talk about doing exercise, correcting your vitamins based on your blood test, correcting your hormones so your body's functioning like it did 5, 10, or 15 years earlier. This is a major amount of prevention so those things don't happen. But it does take work. It does take the time to do the exercise. A little bit of activity every day helps. Correcting your vitamins makes a very big difference. So it's something that takes time.
We got someone on YouTube just saying, "Thank you for not shoving statins in my face. You seem to be one of few that are not going down that route."
There aren't many doctors who would tell you the truth, but the issues typically are that when you are just using medications to change a symptom, you're not able to change the cause and the problem gets worse. That's like saying a person's got shoulder pain. Oh, here, take Motrin or a pain reliever or a steroid shot. You may feel less of the problem, but if the doctor didn't do a test for range of motion, didn't do, and I'm not a big fan of x-rays as being the final test because they don't show you ligaments, tendons, and cartilage. Everybody that's heard me would know that. An x-ray to look at the bones. Do you have bone degeneration or osteoarthritis? Or an MRI. You have tears in ligament, tendon, cartilage, cuff, and you're covering the symptom and you're still doing your activity, you're making it worse. So that's why we have to have that thorough definition of exactly what's happening rather than just covering up the symptom. So traditional medicine is not like or likely to do the nutritional and all the testing that we do. They just don't.
Can stents and bypass surgery remove plaque, or do they just open new pathways?
Stents are just opening a pathway. So if they find a segment of your coronaries that has plaque and they do a catheterization, they'll put a little device on the end of the catheter and then allow that to pop open inside your vessel to sort of smush the plaque and hold the blood vessel open. Do they always work? No. Are there some people that 3, 4, 6 months later have plaque buildup again? Yeah. So it can't just be that temporary fix. That can be done when people are in grave scenarios, but you have to change the entire picture, all of the entire picture. If a person's hypertensive and they're overweight and they have plaque and they're doing stents, if you don't help to change everything else, bring their weight down, decrease the extra fluid that fat cells are holding on to, get the pressure to come down. If you're not changing all of that, you're not getting your best result or outcome.
Is aspirin still recommended to reduce clot risk for people with plaque buildup? I still
Yeah,
take
it's
them
still
every
recommended.
morning.
You know, people will take a baby aspirin just to decrease the extra fibrinogen or clotting effect, and that may be beneficial. So that's one thing that can be recommended, but it's not covering everything. If the vitamins are low, if heavy metals are on board, if hypertension's there, if a person's eating junk food, the aspirin's not going to do that much. It's got to be working on every part of the picture to get the ultimate benefit. And there are people that have simple combinations of this group of problems, and yet there are others that have multiple, which obviously makes their picture worse and can progress faster. So the idea is that you want to find all of these things and fix all of these things. The other comment to make is that with the remote patient monitoring mechanism that we're doing and expanding that, having a person check their blood pressure every day is a great thing. But if they're not giving you a track of the blood pressure results and they see you a few times a year, what are you really getting? A couple of readings. The beauty of this is that when you press the button after your blood pressure is done, it goes to our data into our computers so that we know what your blood pressure is doing every day. If we need to say, hey, your blood pressure has gone up in the past 3 months, 6 months, etc., or you have fluctuations on certain days, etc., you want to address it, fix it now before it becomes a bigger problem. So that's genius. Same thing with blood sugar and using a glucometer to check your sugars. Whether you're sticking the finger or putting the device on your arm, the Dexcom or the Freestyle Libre, I think they're great because it shows us what your sugars are doing. We tighten the diet, you increase the exercise, and now we can track you better from what we're doing and what you're doing at home, and you get a smartwatch with your pulse and your oxygen. So we're looking at all these vitals and then can intervene when we need to. That's genius because it's brilliant because you're working with that patient more often, doing telehealth, phone call visits, and you're preventing a great deal of disasters.
Yeah, someone's in the chat. It said, it's like having you on my back, doctor. I like it.
There are new things coming along, too, and I mentioned this before. There's a company in Switzerland that makes glasses you wear, and the sidebar of the glasses will read your brain speed so we can see if your brain is slowing down, and AI compares that to 1 million other people who have done it to see how your brain is aging in just speed in that one parameter. So that's a way to see if your brain's changing. And again, we could take steps to improve your brain function, vitamins, minerals, stem cell, whatever. We have a device in the office called a brain scan. And the company makes this. It's a funny looking cap you wear on your head. Put a little gel in the little openings and you put little electrode devices that read your brain waves. It goes to a computer and you press a little thumb button when you're prompted to do so. It looks at your P300 score, which is a speed score. It looks at all the different areas of your brain because the little electrodes cover different areas. And we can see the entirety of your brain speed and function and see how much function you're losing. So that's important as well. If you start to see that, then great. We want to be able to change and reverse that mechanism. So the brain scan is a very important test to do to evaluate your brain now, as opposed to waiting to where you're forgetting everything and you have some major issues.
Someone's just curious on, is that like ready to come to market, or is that going to come down the line?
Well, we have it. We've had the brain scan in the office for a while. So years ago, the company that makes it kept fine-tuning it. So I think it's a terrific test, and we've done it. So this is something we've had for a while. But like anything else, new technology and with AI, it's just a whole new ballgame, but in a great way, because we're able to compare and see what happened to other people that, went into full-blown dementia, memory loss, and Alzheimer's. So we have comparisons that are far greater than ever before. So it's a brilliant test.
Oh, we just got a follow up. They were referring to the sunglasses or the glasses.
The glasses, yeah, it's not available yet, but we're kind of waiting and watching to see. So that's one component, but that brain scan test has 15 pages of tests. So it'd be cool to have the glasses on when you get up in the morning, have a glass of water, have a cup of tea, go sit down in a little health room that you've made. And I'm thinking futuristically, but it's not that far off. People make rooms for all sorts of things. They'll spend $1 million on a bathroom. They'll spend tons of money on this or that. But why not make one little room where you have an exercise bike and a chair? You go and you sit in the chair, you put your glasses on, you have your smartwatch, you have your glucometer, your blood pressure cuff, any of these things. There's a device that we're going to be using soon where you just put a little patch on your chest, reads your heart rate, and so will the smartwatch. And you can get on the bicycle and pedal your bicycle for a half hour, and you're doing like a little mini stress test. But we're getting all of these parameters, all these vitals, and we're watching exactly what your body's doing with activity. It's spectacular. And you can wear the glasses too and put those things on in the morning. Do that, press a button, it all goes to the doctor's office. What could be better?
That's crazy.
What could be smarter? Nothing.
It's crazy. Someone in Rumble is just saying, like, we're going to get to a point where we're just going to wake up in the morning. It's going to say, hey, you're coming up with a fever, do this, that, the other thing. Yeah.
Yeah, it may very well be. I mean, I don't see why we shouldn't have that. I think it's a great idea. You sit in the chair, and I think a company's making a chair that looks at your circulation, almost like doing sonogram tests, looks for your circulation. So you'll get a great, wonderful amount of knowledge and information from that patient right to the office. Doctor looks at it. Mrs. Jones, you're great. Your blood pressure's down. You've dropped your blood pressure 10 points, in the last month. This is what you want. I'd rather be able to do that and get real benefit, real results, preventive medicine, than sit there with a person who's gone way off track and ends up with things that are hard to fix. I'd rather prevent and fix things first so they don't get to that bad point. But it's coming. I mean, it's here, but more of this is coming. So obviously we're going to let you know as soon as some of the other modalities come in. But we've got the brain scan. We have the cuffs for checking your blood pressure every day. There are a few different smartwatches. So we're working on which would be the best. Samsung makes a beautiful watch. And different companies now are in the manufacture of these smartwatches because they're not difficult to make. And they give us all of these readings. There may be a bracelet coming out soon that you'd wear that looks at all of this information. So they're not necessarily going to be designer-style watches or bracelets, but still.
Who knows? Rolex.
You never know. we can get more people to do it if it's trendy or designer. But this information's here, and we can do this. So we love it. And Medicare has taken this up as a champion because they want their Medicare patients to be healthier. I'm saying that in a very polite sort of way. I think they also love the idea that if we can keep you healthy and fit and track you month to month, and Medicare pays a fraction of what they would pay for you going to the ER and getting some massive workup, they're saving a huge amount of money. And this has already been documented. So there are studies where people have looked at this side by side, and what the insurance companies and Medicare is saving is a staggering amount of money, and that's good. I just care about the patients and don't really care about insurance companies because they have more money than they know what to do with. But I love the idea that you can save patients aggravation and, morbidity, mortality.
We got a quick personal story from Rumble. My brother was only 52, never smoked, wasn't overweight, and honestly looked healthy. One morning, he went on his usual jog and collapsed. Doctors later told us it was a massive heart attack from plaque rupture, even though he never had chest pain before. How is it possible that someone can seem perfectly fine on the outside but still have this hidden danger inside the arteries?
So typically, as people and as doctors, we look for symptoms. It's part of the presentation. And I've seen people that are asymptomatic. I had a patient who would ride his bike all the time. He'd go on bike trips, and he wasn't a professional cyclist, but he did a lot. And he was lean. He was in good shape. And then at one point, he ended up having some symptoms, and he went to the cardiologist, CAT scan, catheterization, and he had plaque. And the plaque started to make him short of breath. And he's like, I don't understand. I exercise a lot. I do the best that I can. But sometimes if certain things are being missed, maybe his vitamin levels weren't perfect, or the hormones were changing, or heavy metal exposure, etc., infection, some people are going to build plaque. And everything he did with the exercise was keeping that under some control until time passed and it built up. So if you have a person that has a little bit of plaque in their blood vessel, trying to figure out how to do this. There we go. That's not totally blocking off the blood vessel, but it's there. So the plaque can be there. A little plaque could be down here. There we go. Here, when you're looking further up, that's a lot more plaque. And here, that's a lot of plaque. Now, you still have blood flow there, but you mentioned a moment ago plaque rupture. So if you have a decent amount of plaque in the blood vessel and a piece breaks off, and that piece is bigger than the blood vessel it's running down, it will block that blood vessel. And that's how heart attacks occur from plaque rupture. Looking at many, many thousands of sonograms of vessels, carotids, etc., legs, over many years, sonograms looking at blood vessels all over the body. Sometimes you see where plaque starts to become ulcerated, which means instead of smooth plaque that you see that's sort of glistening and, it's almost like a fusiform shape where the blood can pass over that, sometimes a little bit of piece of the plaque starts to pull up more and more as blood pumps by it. And sometimes that constant pumping takes that piece of plaque and lets it fly. And that's how the plaque, can be created to clot and create the heart attack. Certainly when I see patients, and we're talking about this, even for healthy patients, family history or otherwise, we'll recommend doing sonograms of the carotids, the echo, abdominal vessels, lower extremity. For women, we do abdominal and pelvic sonograms to look at the ovaries to make sure they're not going through some sort of change. So some of these tests are really important because without them, you don't know what that plaque looks like. There's also an MRA test that is an MRI, but of your blood vessels to see if there's plaque, and certainly looking for ulcerated plaque. So there are certain studies that are much more accurate that can be done to evaluate if you're stepping into a zone of risk or danger.
We got a question regarding clots. They just want to know, is a clot the definition of something, or is it, like you said, plaque being
They're
something
two
that could
separate
clot?
things. Plaque, as you would see here, I mean, of course, it looks yellow here. It would look yellow potentially, too, inside your blood vessels. That is either a gummy or a hardened process on the lining of your blood vessel. A blood clot, as people have seen what clots look like, are typically blood and maybe fibrin to make it look clumpy. And people have had a bleed, or everyone kind of knows what a clot looks like, a blood clot. So if inside the blood vessel, inflammation's occurring and you have a lot of fibrin or fibrinogen, which looks kind of like a gauze pad, the wispy cotton of a gauze pad, is meant to help to block, to clot if you're bleeding. But if too much of that is there, then this blood and the platelets and the fibrinogen, that becomes a clot. That can block a blood vessel and cause a heart attack or a stroke. And for that scenario, they'll give you clot buster injectables like TPA. These are medications that are used to dissolve that blood clot. But a blood clot and plaque are two completely different things. They may have the same end result where they can block a little blood vessel, and you may not need to have a really big clot to block a little blood vessel like the ones going back to your heart or the ones in your lungs. Plaque usually has to be more significant if it's in your neck to create a stroke because you have bigger blood vessels. But either way, these things accumulate over time, and that's what becomes the problem.
We got some jab comments I'll avoid.
What's that?
Some jab comments.
Jab?
Vaccine related.
Oh, yeah.
COVID
well,
shot.
That's an absolute. You don't have to have me tell you that certain injectables can create an inflammatory mechanism. If you're taking an injectable that confuses your body as to what to listen to in terms of messenger RNA, you have your messenger RNA telling your body what to do all the time in all your cells. Something else comes in and changes that, and now your body's confused as to what to do, then problems are going to occur. Myocarditis, clots, autoimmune disorders. There's a lot of it. And you could look online, you could look at TV and see what's happening worldwide. I wouldn't just look at locally, look at worldwide, because you'll get you'll get a better perspective. That's why we talk about using combination nutrients that help to inhibit some of that. Nattokinase is great, and people can use that to decrease the clot risk or potential. Quercetin, curcumin, a variety of other things can be put together with that, and we may use that as a little vitamin pack in and of itself. So once we see your blood work, if your fibrinogen, C-reactive protein, homocysteine's high, and your vitamins are low, I know exactly what to do because it's right in front of me. So I put together a combination of those nutrients into a pack. So there's a morning pack and an evening pack. Covers everything your body needs. Yes, we may add on other things separately. And then within a month of using the pack, recheck the low vitamins. So now your D level is great. Your B12 levels are great. All those things that may have been low are in great range. We'd also want to look at your clotting factors and see if those have come down from taking, appropriate nutrients or even medications. So, we have to use a scientific method, learn about something, make recommendations, and then recheck to prove that you've done the perfect thing, perfect recommendation.
You guys are funny in the chat. They got good nicknames. The Clot Shot. Haven't heard that one.
Oh yeah, that's what all the guys in the ambulances talk about. Clot Shot. There are a lot of little funny nicknames for things.
Oh, you guys keep me young.
Got to do it. I went out to dinner. My friend played golf with his friends over a beautiful course, Mill River. And I met them over there, and we sat down and had a great deal of fun. But the group of guys that played are just characters. They're one's funnier than the other, talking about this and that. And one of them was a retired cop, and this guy could do stand-up. He was so funny. So we're all laughing like idiots, and all the people around us, outside, it was beautiful. We're laughing, and people are kind of listening to the conversation, but what a funny group of people. And the guy stood up and said, "Doc, do I look old?" And now everybody's looking at him like, I guess he doesn't have a problem standing and speaking in public places. I said, "Nah, you look great. You look like you're 25. He goes, "Oh, yeah, I love you, Doc. What do I have to do to get healthy?" I said, "Well, check your blood, your vitamins, minerals." He goes, "I want stem cell." I said, "We'll give you a stem cell. Don't worry." But, some people have a couple of drinks and they get very enthusiastic, which is great. I mean, I love enthusiastic patients and people that want to be healthy and strong and young. And, "Oh, my daughter's getting married. She wants to have kids. I want to be there for the kids." I said, "I'm sure you will." But we try to make sure.
It's always the cops and the firemen. They're the characters.
Oh, yeah, absolutely.
They get me going.
Absolutely.
Got this one. I had genetic testing done at NSLIJ.
Mm-hmm.
They told me that I have factor V Leden, Leden, and they said it's hereditary, but nobody in my family has ever had it.
So the hereditary thing is genetic, it's factual, but you may not have ever heard about that because they didn't do this testing 50 years ago or longer, certainly not. And it's hard to say exactly when they started doing it, but maybe your family didn't do it because the doctor didn't know about it. They didn't know about it. So it holds true with everything that's described as being genetic. I mean, 50 years ago, there was only a little bit that we knew that was genetically related. They still think, some people, that your cholesterol is a genetic thing. It's not. As much as they try to say that, the genetic issue, I can't change the color of your eyes, how much you structurally look like your mom or your dad, or your sisters or brothers, etc. But I can change your cholesterol all day long. Cut the carbs, do the exercise, correct vitamins and minerals that are low, correct hormone decline, put everything back together where your body's just a great fat burner. And we could do that. You might have an increased risk for the gene, but I think that's the least potent part of the picture because we'd be able to change that in people. Little aside story, many years ago, I looked at Ancestry.com and I wanted to look at, my father's side, because my father's side of the family is very small. My mother's side of the family is gigantic and would be a massive undertaking to try to get all of that done. And I still want to do it. I have to figure out how to do it. But there were pictures going back for different people, and my uncle was a very good-looking guy. My dad was very good-looking. And going back a few generations, I saw a woman, and I looked at her picture, and this is many years ago, an older picture from generations back. She looked identical to my uncle. It's like my uncle put a wig on. I was like, my God, the genes are so strong, because she looked identical to my uncle. And in our family, they keep carrying names, Santo and Laterio and Santo. And they were just every other name was Santo and Laterio, and she was Lateria. But I'm telling you, if you saw my uncle, I don't know what age she was in the picture, and it was just a duplicate. So there are very strong genetics in some people and less strong genetics in others. But those things you can't change.
Yeah. I got a similar thing in my family. We got one person said, "Don't trust the gene companies. Ancestry is going to steal your DNA." It's always
people say that, and I don't like trusting anybody actually. But if there are people out there that want your info, they've got it.
Right.
They've got all your banking, all this dark web stuff. They've got everything that you could possibly do. They know about.
You have something else? Sorry, I want to cut you off.
What's that? Yeah, they can find everything about you without a doubt. So there's no way that you could keep everything totally and perfectly secret. With your DNA, I mean, with that DNA test, what are they going to do with it? Clone you? I doubt that. But I saw something really weird today.
Oh, no.
On one of these things. I was going to tell you about this before the show.
Uh-oh.
That it's hard to describe, that there is some belief that there is cloning going on at Epstein's Island.
Oh.
And that Gates is involved. I mean, this is something that someone has as a possible theory. And this person is a well-respected person. Maybe Saturday I'll come on and we'll talk about that.
Yeah, we will.
We have...
I think Siri.
That's my phone. Yeah, Siri's listening.
I'm like, there's a woman in the...
Big Brother's listening in or something.
Interesting how that happens, guys.
Yeah, Saturday's going to be a good show.
Oh, yeah. And just a follow-up from the Factor 5, they said none of them, I guess their family, none of them had clotting issues. And then he said, I have clotting issues. I had kidney failure, and I was on dialysis for 3 months. My blood kept clotting the dialysis machine.
If no one had issues and you didn't have them earlier, it would be hard for me to say the only possible thing that contributed to the clotting issues was that Factor 5. So my point would be, no one ever told you to look at heavy metals. No one ever told you to look at all the things we look at, your vitamin levels, C-reactive protein, homocysteine, et cetera. So if we look at all of that and find other contributors, you want to change that. And certainly for people that have had kidney failure, we do stem cells. We do stem for liver, kidney, heart failure, lupus, rheumatoid, diabetes, MS, Parkinson's, Alzheimer's, stroke, macular degeneration, visual damage, diabetic retinopathy, joints, for a lot of things. So we learn as much as we can, and then we put together the recommendations that will give you your best outcome. So those are still important to do because, as you would understand, traditional approach doesn't do all these things.
Oh, you're not going to like this one, Doc. Oh, this is interesting.
Okay.
They caught the Gilgo killer because his daughter sent in her DNA into the ancestry website 23andMe, and her DNA matched the hair found on the bodies.
Wow. Genius.
Genius, but
wow.
They don't tell you that when you're signing it off.
No, but I mean, forensically, wow.
Wow.
They caught some psycho who killed all those people because the daughter's DNA went into the database. And they found that DNA. Wow. Well, then I think it's a good thing.
Yeah, that's wild.
Wow.
Good to know.
I didn't know that.
Thank you, our number one caller.
That's true. I mean, you wouldn't say it unless it was true.
I'm gonna confirm, but this is from our commenters.
Well, hey, if that's, I'm not surprised by anything anymore. I'm always double checking things. But if that's so, then that's the most brilliant use of DNA, to be able to capture someone. Wow. Think about that.
Yeah, right.
Well, look at all the DNA that's either allowed people to be freed from jail that were not involved in whatever they were put in jail for.
Right. They're there for
and
20
look at
years,
people that are captured because of the DNA in other circumstances. You hear this all the time. So, hey. DNA is a good thing to evaluate. And, if you have in a database people related to or who are killers, it's a great way to capture them.
They said, it's true, I saw it on ABC News the day they caught him.
Really?
Yeah.
Wow. Awesome.
Amazing. Slightly change of topic, but another comment. I want to come get stem cell, but I don't have good health insurance.
Well, for people that don't have good health insurance, when we do your consult, the blood work that we do can go to the lab that participates with your insurance. Most people that come in, depending upon their plan, will get 80% reimbursement when they pay for the visit, so, et cetera. So, you can call the office and they can give you the specifics on that. But every patient we've ever seen with blood work draw, which is the bigger expense, if the lab that comes in and takes the blood from us once we draw it has your insurance on their list, then great, then we can draw your blood. But if it has to go to a different lab for your insurance, then we send you with a prescription. You could do that. So that helps.
Boom. Love it. What else?
I forgot to take a picture of my mom the other day.
Still turning black?
Yeah.
Unreal.
From above her ear all around the back to the other side. That's great. At 95.
Anything for people who only have Medicaid? That was an addition.
Medicaid is very tight as what they allow you to do or not to do, so I don't know. I don't know what Medicaid would or wouldn't allow, so I don't know. I'm not sure. We haven't seen Medicaid patients. We have tons and tons of Medicare patients. And although Medicare doesn't reimburse doctors as well as other insurances, and every doctor who accepts all the insurances, insurance companies pay less and less every year. They take forever to pay. And I know a lot of other doctors that accept every insurance under the planet. The only problem is they may be waiting a year to getting paid on a lot of money, even $1 million or $2 million over time. So those individuals who have Medicare electronically pays you within 4 to 6 weeks of that service. So for doctors, that's not a big problem. And even if they reimburse the doctor less, so that's fair. We've always participated with Medicare. So, we do the best we can do.
Got a change up here, talking about how, you went into Lyme disease not too long ago, and they want to know if you've heard about this kissing bug disease that's been going around, and if you have any comments on that.
Kissing bug?
Kissing bug. The kissing bug.
I'm not sure which kissing bug, or which is the kissing bug. There are new bugs out all the time, but I haven't heard about the kissing bug as yet.
Let's see what we got here.
I mean, it may be called something else that I know about, but...
The Chagas disease? Chagas disease
that's
or
been
deadly?
around for a long time.
Okay, it says this is a new article from December 9th. It says Chagas disease or deadly kissing bug disease has spread in the U.S. Here's what we know. And now I don't pay for CBS, so they're not letting me read the rest. But
Yeah, I haven't seen it. I haven't seen any patients with it. Just like some other bugs that seem to come and go. Chikungunya was a funny name of a disease that had thought to be coming in and going to create a major problem for us. It never happened. So I don't know. We have to look at statistics and where it seems to be showing or popping up. But I haven't seen hide nor hair of it, so we'll have to research that.
There's always something.
Yep. Always bugs coming in. There's always a new flu bug every September.
Couple types of bugs.
And I remember, and again, you can't blame me for this. Newsday, a few years ago, Newsday published an article that said, we don't understand the injectable every September because how long would it take to make 350 million injectables for a bug that comes out, a different bug every year? It's probably 3 years. And they were saying then maybe that's why the injectable doesn't cover the bug that's here when they want to do that. So you can take that for whatever you want, but research it and try to figure that one out.
Yeah. Someone in Rumble's making a great point. How is it every year? If it was like a year and a half, year and a quarter, like to the minute, they just know when it's New Year's? You're making some good points.
Yep. I love people who are critical thinkers, who like to just take the info and look at it, chew it around a little bit, spit it out, gnaw on it and, think about it and use some rational thought, I think that over many years that's been downplayed on purpose. But don't want people to be thinkers or individuals or to think about things. They just want people to follow what the status quo wants you to follow. So you have to be thinkers.
Yeah. We do have...
And read and learn and look and,
We have some people are just curious on. I know we're gonna be covering this on Saturday for sure to our LFA TV audience, but people are curious on your thoughts on the event that transpired last week. As a medical professional, at least they're curious on.
As we were saying before, and we spoke about this, when it happened. I've never been so furious, angry, incensed, irate. And to some extent, sad and heartbroken at the same time. I think this is something that was created. I think there's a great deal more to this picture. I think that it doesn't make sense to me that some young kid, whatever his views are, and whatever this nice little story wrap up, they're trying to present it. Oh, here's the story. I hate that. I didn't believe it when Kennedy was assassinated. I didn't believe it when RFK was assassinated. I didn't believe it with Martin Luther King. I didn't believe it with any of these popular, great people. That Princess Diana, the list goes on and on. Caesar, you can go all the way back. I think these are things that are created to happen to benefit some group, some people, something. And to blame it on a lone person who, and you're going to hear more and more, why he might have done. I don't believe it. There are too many things that don't make any sense about this. And rather than give you a huge commentary now, I thought, we'd wait till Saturday, our super big audience, and talk about that once I gather some more information. But I'll give you an overview. There's no video that shows this kid with a rifle. A rifle is not concealable. They're 44 or so inches long. You can't stick it down your pants and run because it won't let you run. If it's in your pants, it's a long barrel. that's not a breakdown rifle where, and there are some rifles where they come where you screw it on, screw it off, very, very few, and put it in a briefcase. That's not a breakdown rifle. You couldn't do that. And why would someone that had the rifle shoot, break it down, get off the building, put it back together, and put it in the woods? You would never do that. That makes no sense. There are more things that don't make any sense about this than that do make sense. But I feel this is a wrap-up. There are people, his neighbors said that people came to his apartment with trucks and very suspicious people. I think those were people that were creating part of the setup. Candace Owens, who's a brilliant woman, full of faith. I like her. She's going to come out with information that'll give you more reasons to question this. Apparently there was a guy there who was at 9/11 and the Boston Marathon, etc. And he was the one who said, I did it, shoot me, to try to distract people away from something else. It's all distraction, smoke and mirrors. I've had conversations with people about the Kennedy assassination, same thing. There's like 70 things that make no sense that are all part of the smoke and mirrors to make you think that this dopey guy with a Mannlicher Carcano, a gun that couldn't possibly make those shots as a car is moving away from him, etc., it just doesn't make any sense. So there's a lot that needs to be thought of. But I'm just furious that we've gotten to a point where there are people that go online saying, oh, yeah, he deserved it and this and that. Where's your mind? Where's your heart? Where's the thought process? You don't think about his wife, the kids. You don't think about anything else except your immediate thought. And I know a lot of doctors and psychiatrists and psychologists, and they think that there's been, over time, a brainwashing, whether it may be chemical related, or brainwashing that occurs in scenarios and group talk and gets everybody to start thinking a certain way, and they lose that humanity. They lose that ability to be polite and thoughtful, and they just shoot out with the thing that makes them feel powerful against something else. And I just don't understand, why. But I know that there are different components that allow people to just lose that humanity, and in their limbic system or the hypothalamus, they just don't care. There are killers who can just shoot up and go and kill a dog and, kill a person and have no remorse. That's an aberrant brain. It's an abnormal brain. Look at the guy who killed a lovely girl on the bus. And then some judge lets him free. I don't understand, how that works in society. I think, and again, I have a lot of opinions. I'm much more conservative and much more protective of population and people than to let this stuff happen. Look at all the people that have been killed over the past bunch of years because criminals are coming in and doing these things. Killers are coming in. It's evidence. Lincoln Riley, of course, is one of many. So how is this okay? When I was a kid and I turned 65 in April, although I know most of you think I'm in my 30s, I turned 65 in April, and everybody loved each other. There were no enemies. There were no fights. There was no Republican versus Democrat and all this animosity. This has been created over the past decade, and it's done so purposefully. Everybody loved each other, liked each other back then. I had a ton of friends. All we did was hang out. We played this sport, that sport. There was nothing other than civility, friendship, respect. It was amazing. And the more that I see this crap going on, I start to feel bad that what was there is gone. And I think it's being created for purpose. I think it's being created to get people to come in to be added to voter rolls. We're seeing that because you're trying to redistrict and get more people on voter rolls for different politicians and stuff. It's just the world has lost its humanity. It's lost its ability to care for other people and care for itself. But it's infuriating,
Yeah, to even think like back when JFK was killed, that there'd be a side, like the right, like so many people from the right would be like, oh, great, he was killed, like we've come such a crazy way as a society.
It's just people have a lot of thoughts and ideas, and I respect everybody's opinion. And I would just say, research it. If you have an opinion, make sure that it's got something behind it that you can stand by and have a discussion about it. Even back then, and I think the JFK assassination was the first time they were talking about the word conspiracy theory. So I tell people conspiracy theory was made by people that are going to do something horrible to make you think that you're crazy for questioning what they did. That's what it is. And how many conspiracy issues have come true that have been proven. Elon Musk was quoted as saying that. He goes, show me one that we talked about that didn't come true. Who had to gain when JFK was shot? You know, there are some very specific people that had a lot to gain.
Or organizations.
When he was pushed aside. Certainly the most was Johnson. No one can deny that. No matter how much you love either side, and I think that whole thing, put this side and that side and die hard this, die hard that away. Think about it, you know, objectively. Who had the most to gain from that? That's the ultimate question. Who has the most to gain from this, from killing Charlie Kirk? Not a kid. Whatever his preferences are with his roommate, there's no reason for it. Because you do something like that, you know, A, you're going to get caught. B, you're going to spend a life in jail. Or Utah has the death penalty firing squad or something like that. Why would it be a good idea to do that?
Right.
And then lose your entire life and your existence?
Right. And me and you, we've spoken about, you know, how many school shootings have happened since me and you have been on the air. And,
unbelievable.
Right. And me and you talk about, you know, the just the mental capacity of these new generations and how, you know, they're isolated a lot and all that stuff. But when we see those people that are killing children at school, they usually end up killing themselves or, you know, wanting to take the blame. Like, it was me, I did it.
Right.
And this one, it's like, no one wants to blame.
It's an aberrant thought process. It's an aberrant and abnormal brain. But my point is, why don't we put police stations in schools? Set up a station, a couple of cops there all the time, all day, all afternoon. That's where they would have their job. Put them there. You can't do that to protect kids. Why not? You're spending crazy amounts of money on all this other garbage. Look at all this USAID money. You know, trillions of dollars going out for all this crap. Why not take some of that money and put police in schools? Protect the kids. What's more important than that? You know, you got a police precinct 10 miles away. Put a little precinct in the school. Teach the kids, show the kids what the police are like. I've seen videos of different police going into different neighborhoods and everybody loves them, different backgrounds, different ethnic and different races. And Shaquille O'Neal went with some cops. And there were kids playing basketball in the street, just a pickup game. It may not have been a great neighborhood, but I don't know the whole story about that. But the police said, yeah, we'll play basketball with you. And the kids are surprised because, you know, they're told not to like the cops or something. And then Shaquille O'Neal comes out and they're playing with the kids. They had the best time. So that's the way it should be. It should go back to the way it was when we were younger and more respectful and more tolerant and more agreeable. But the weird thing is, it's just, and you see a lot of this, so you disagree with someone and it's just, they're rabid. There's no calm discussion. And that was one of the things that Charlie Kirk was working on, to try to get people to have conversation. I mean,
discourse.
Who would want to go into a place where people don't like you and hate you and have calm, substantive conversation? He did that. And he should be applauded for all those things that he did to work with people, discuss. He didn't shoot back at people and be as vehemently angry at them as they were of him. It's unbelievable to me.
And for these people to call him an extremist, like, that guy was a moderate.
Yeah.
Charlie was a moderate.
They call all sorts of names to people because they want to have that name tagged. Fascist, you know? Did they know about fascism? No. Can they describe what that is? No.
Have they experienced it?
No, they know nothing about it, yet they have to throw that label to get everyone else, oh, and then other people follow, oh, yeah, they said he was a fascist, so it must be. Exactly the opposite. A man of great faith, willing to continue to do this to help people and to get the good word out, get people to, follow religion, follow God. And he was martyred for it. And just as his wife described when she got up to the podium and was talking, look at the number of people worldwide doing vigils. Look at the number of people out in the streets in every country. I've seen this in New Zealand, in Australia, in Brazil, in England, millions of people on the street. Portugal, South Korea. There was a video of people talking and a massive number of people all saying, I am Charlie Kirk, in their accent. But you could understand it. So all over the world, people are rising up. There are 900 chapters, I believe, of Turning Point USA. And now there are 32,000 requests for opening chapters. 32,000 requests for opening chapters. People going to church in massive amounts. People that never went to church and were this or that about it are getting up talking about how this is bringing them to church. So it's just ridiculous. The world has gone, crazy, gone to hell in a handbasket. But hopefully maybe this, and they say this is the turning point. People are coming back. Maybe this will get people to be reasonable again. Hope so.
Yeah.
Do we have any comments? We'll chat with some people.
Plenty. People are mostly at a loss, but one said they wanted Charlie gone because he was going to run for president next. I wouldn't say next, but he was certainly going to be a presidential candidate.
There were questions and interviews. I saw this numerous times where interviewers said, well, what do you think, Charlie Kirk for president? Nah, I don't know, and blah, blah, blah. I've got a lot of stuff to work to do. Another one said, oh, Charlie Kirk would be a great vice president, to some of the other people that are in the, so that was already happening. He had a massive following. So that was something that he would have been either pushed towards or led towards, just the way it is. And I think that made more people incensed against the idea. When I was young, Democrat got in, Republican got in. Who cared? Actually, I hated the fact that Jimmy Carter, when he won, the interest rates were so high, everything was expensive, and my medical school loans, et cetera, were through the roof. And I'm like, how am I going to survive? I can't pay this money back. I did, but it goes back and forth. Democrats were in for a while, Republicans were in for a while, just back and forth. And nobody had any major animosity against it. Now it's just full-blown insane. So I think that's another reason. And Candace Owens is going to come out with some info. And she may be doing that today. If she does, we'll jot it down and we'll talk about that. Because I think there's a lot of valid discussion and valid points that she makes specific to another country and foreign interference. And a lot of people that I know people in the FBI, I know people in different realms, again, psychologists, psychiatrists, this was a specific op to be able to take this person out. So
this is a good question. They want to know, as a medical professional, the injury that he had sustained, do you think that there would ever be a scenario in the future where something like that can be saved? Like a jugular scenario?
As much as I would like to think so, I don't think so. Because whether it was the gun they said or the bullet that they said, if it were the bullet they said, honestly, I would have expected a great deal more trauma.
Right.
And some guy on one of these platforms came out and said, look, I'm a hunter. I use that round all the time. I shoot deer and other animals. It creates a much bigger
spread
reaction. It creates a big exit on the opposite side. And again, everything at that spot where he was shot was dismantled and taken down right away. There was no CSI or forensics done. That has to happen, but that wasn't done. Everything was, cleared up. And now they're taking the grass and stuff out and going to put cement there and put flowers. So that's just more cover-up. That kind of bullet, and I'm not going to say it was that kind of bullet because I just don't think that was right bullet, but to be able to hit either below the clavicle, which would hit your subclavian artery coming off your aorta, and the aorta turns, which is a big blood vessel, turns to get your blood to go to the rest of your bottom of your body. It turns into the subclavian artery and goes into the carotids, which go up to your neck. You have a lot of blood flow right there. So hitting below the clavicle or above the clavicle, it's not like sticking a pin into a pin cushion or a nail into a piece of wood that's a localized penetration. The cavitation of a gunshot wound, and some people have seen this on TV videos, they shoot into a block of gel to watch the cavitation effect and wow, 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 wow.
Mythbusters used to use
even
that.
A small bullet will hit and create cavitation so that blood vessels would be damaged. So a good friend of mine's, a funeral director, and we spoke about this, even a small round would hit. And if it hits an artery, then arteries are a little bit tighter and stronger than veins, but veins could break very, very easily. So hitting that area, there's no chance of survival when you hit those vessels, small or larger bullet. But I don't think it was a big, large round, because it would have been a bigger explosion, and there'd be a big exit wound in the back that no one has spoken about. The other thing that people are talking about, when the bullet goes in and hits the vessels, and the bullet can fragment, when it hits the cord, your spine or your spinal cord, if the spinal cord connection with your brain is severed or damaged, you have a you have a reaction that's called a decorticate response. Your hands pull up, your legs can turn in because that connection is damaged or severed. And that's exactly what happened. Mm-hmm. And then the movement, to the left would occur. That's exactly what happened. And at that time, the visible picture of the initial blood coming out and falling over. Remember, blood's going to go into the body, the internal cavity of your body, because there's just nothing stopping it from just going straight down. So you have straight down, you have coming out. And so that amount of blood loss in moments and severing the cord, allowing that decorticate response, there's no chance. As soon as I saw that, I just sort of was shocked, horrified, and I thought, there's no survival with that. And you could have been an ambulance right there at the site and put pressure on it, but you're not stopping the blood from going down inside your body cavity. There's no chance. And whatever professional made that shot, made that happen. So anatomically, there's no chance of being able to take that. And honestly, even if they were on the operating table, you can't reconnect the brain and the cord from that injury. You can't clamp off those gigantic vessels quickly enough. It's just that rapid. The term is exsanguination. You're losing the blood. I mean, there's just that rapid a loss and neurologic trauma that there's nothing that, could fix that.
And chat's just saying thank you for going through this analysis. They said when it happened, they've been waiting to listen to you to find out.
Most people don't have the anatomical understanding, of course, and most people don't understand, how bullets work and stuff. But that's exactly what happened.
Yeah.
And people are saying, oh, well, this or that, or whether he had a vest on, I don't know. I didn't look closely enough at his shirt. I don't think he did. But he had a little microphone on his shirt, which people say, oh, what was that? It was a microphone because he was, recording for himself. And, but people should take this as a lesson as to what's out there. And people who don't like you are dangerous. And I imagine this could happen to anybody. Look at the poor young girl on the bus. And I don't want to minimize the conversation about her, but in a similar way, someone came in and stabbed through the neck. There's no chance of repairing multiple stab wounds to the neck. And what was the reason? And there are some hot-headed people that have been saying things that this was racially motivated, comments that the guy made afterwards. That's been, documented. But whatever it is, I tell people everywhere you go, especially women, be careful. Look at your surroundings every single place you go, daytime, nighttime. Look to see who's near you. You don't get on a bus and have your back to whatever. See what's around you constantly. Always look over your shoulder. Look through the glass if you're walking by a store and see if there's anybody behind you. Get some self-preservation device, whether it's pepper spray or something. They have these devices that zap people if they come to attack you. I don't know. I've told my friends and family and everybody else, if you're inclined, go get a permit to carry a gun. These are the times where that sort of thing may be needed. This is not the safe world that we knew many years ago. It's a whole different world. And do not put yourself in places that are suspect. And I tell my friends that have kids going to college, do not put yourself in a place where you're unfamiliar, where you can't see the exit to be able to get out of a place or a building. There have been fires started, and this was in Florida. I remember this whole thing in one of the clubs in Florida. Oh, yeah. Some fire was lit and people couldn't get out because they didn't know where the exits were. Sit near the exit. Just be smart. If you want to call it paranoid, okay. But you might be paranoid and alive as opposed to paranoid and not alive. Look at every scenario. If you go out to your car in the evening, look around. Look in other cars. Look to see if someone's in your back seat. It's crazy that you have to do this, but do it. It's smart. Take self-defense lessons, anything.
My buddy always says, only the paranoid survive, and I'm starting to realize.
Absolutely. I would have wished that Charlie Kirk's team had drones there. I would have wished that he would have realized, and Candace always is going to talk about this because he was worried about something. We'll talk about it Saturday. I would have wished that there were better security and protection and something that would have blocked, a projectile from coming and hitting him. Anything.
Yeah. And I've heard from his team that people have asked him to do that, and he didn't want any distractions.
He didn't want anything to block his connection with the people, even the people that didn't like him. He wanted to be able to have open conversation with.
Yeah,
it's heroic, but and now other people that are going to be doing speaking and stuff like that, and other celebrities, they're going to need to be very, very careful. It's a crazy world. Okay, we'll get some more information for you. We'll come back on Saturday. We'll talk a great deal more. Thank you all for listening. God bless you all. God bless Charlie Kirk and his wife and his kids and his family. We'll come back Saturday and we'll chat. Thank you.